We want to get the latest from Ballot Health Chief Clinical Officer Dr. Amit Vashish. Dr. Vashish, thank you so much. We'd love your reaction to the latest numbers from Ballot Health.
Josh, thank you so much for having me. It's great to be again with you and our viewers. We continue to be very encouraged with the way our numbers look for hospitalized patients with COVID-19. I think what we saw in the last couple of months was a terrible surge that was unleashed by the Delta variant. What we are seeing right now is the number of cases continue to stagnate, and we continue to expect that for the next several weeks. What happens after that is anybody's guess. The virus certainly has surprised us before. So all we ask our community is to consider getting vaccinated if you have not already.
Well, and you're saying we can't say for sure what's next, but I would love to ask you about something that we are hearing about, which is something called the Delta Plus variant. What do you know about it, and what should people know about it?
At this point of time, Josh, we don't know much about the Delta Plus variant. What we do know is that it may be slightly more transmissible than the Delta variant. We have majority of the data coming from the United Kingdom, where they analyzed certain samples of patients with COVID-19. And I think their data points out that about 8 to 10% of those COVID-19 patients have the Delta Plus strain. In the United States, there have been some genotyping studies, and they have detected some Delta Plus strains in California and in New York. We have done extensive review of literature which states that it may be about 10% more transmissible than the Delta variant. What I do feel, reviewing the literature and speaking with other public health experts, is that we may be done with the worst phase of the Delta variant, Delta variant pandemic that occurred in the last few months. And we also feel that the Delta Plus variant will not be able to impact the trajectory of the numbers that we are seeing in a way that will kind of wreak havoc in our communities. But again, very early data, very preliminary data.
Let's hope that it is not as bad as what we just have gone through. We have heard for all along that children remain at least risk for the most serious complications. With that said, children have been getting sick and have been spreading the virus as well. And now here we are on the verge of what appears to be all thumbs up for vaccinations for those 5 to 11. What do you hope parents understand, and who do you hope among the child population 5 to 11 goes to get vaccinated?
I think I would encourage all parents who have kids between the ages of 5 to 11 years of age to talk with their pediatrician, their family physicians, public health officials, and even some of us in Ballot Health if they have any reservations about getting their kids vaccinated against COVID-19. We hear a lot that the disease did not impact the kids as severely as it did adults, particularly older ones with chronic medical conditions, so on and so forth. But if you're considering vaccinating or not vaccinating your kids, I think there are a few facts to bear in mind. Number one, during the COVID-19 pandemic, we lost about 170 kids between the ages of 5 to 11 years of age. There were 8,000 plus hospitalizations of patients in the 5 to 11 age group. Another fact to bear in mind is that kids may not themselves get ill, but certainly they will transmit the virus to people in their household, which may include patients. Their parents may have some medical conditions that make them vulnerable, or their grandparents who are slightly on the older side. So, and the last thing I would like to tell is that we don't know the impact of the long COVID symptoms, things that happen in kids, particularly the multi-system inflammatory syndrome, all those kind of things. And vaccination can help us protect against those unknown variables. And sometimes people in the community may say, well, 170 deaths, 8,000 hospitalization, in the larger scheme of things, they don't look as terrible or as significant. And one thing I always like to tell my own patients and people in the community is statistics stop or cease becoming statistics once someone in your household or in your family gets impacted. So let us not take a chance. These vaccines are safe, they are effective. They were tested on 3,000 children, and please talk with us, with your public health department, with your pediatrician, family physician, whoever that may be, and seriously consider getting your kids vaccinated.
Final question I have, Dr. Vashist, about boosters. If you have received the COVID vaccine before, regardless of the brand, and if you're in a high-risk group or you're exposed to in a high-risk situation, you can get the booster shot. And we know that some did get the Moderna, some got the Pfizer, some got the Johnson & Johnson. Is there one booster that you're recommending? Because you can now mix and match. What's your advice to those who have gone a period of time since their vaccination and are considering getting that booster? And which one would you recommend?
I think, first of all, the thing about boosters is people who took the mRNA vaccines like the Pfizer or the Moderna vaccine, they're eligible to take a booster 6 months after their second dose of the vaccine. Now, who's eligible for a booster shot? Folks who are 65 years of age or older, folks between the ages of 18 to 64 years but have a medical condition. And number 3 is people who work in certain sectors like healthcare workers, teachers, grocery store workers who have possibly a very high exposure to the virus. So, and the second thing is about the J&J vaccine. People who received the J&J vaccine initial dose 2 months ago, they are eligible for a booster shot. Now, coming back to the fact that how do you mix and match? But mixing and matching has been shown to be safe. It has been shown to be effective. What we do know in terms of science is folks who took the J&J vaccine more than 2 months ago, when they were given an mRNA vaccine like Pfizer or the Moderna vaccine, they generated a higher levels of antibody than if they were given a booster shot of J&J. So I would leave it to the discretion of the public, whatever they may choose to take for the booster. But at this point of time, if you are in one of those categories that I mentioned who are eligible to get a booster shot, please consider doing so now.
Dr. Ahmed Vashist, thank you so much. We appreciate it very much as always. And stay with us. We'll be right back.